Do you want to improve circulation in your legs? Having proper circulation in your legs is incredibly important because without good blood flow, you don't get the nutrients and oxygen for your muscles to work and for your tissues to heal and repair yourself. That can result in things like ulcers that develop down in your feet. It can result in problems like neuropathy. It can result in leg pain or coldness of your toes, numbness or tingling of your toes. And so it's really, really important to get good circulation in your legs. But there's a lot of bad information or misinformation about how to get good circulation in your legs. I've seen a lot of videos recently claiming that activating a muscle pump by doing calf exercises or exercises for your leg muscles can help improve circulation in your legs. And while that is true to a very small extent, what the muscle pump does is it essentially helps squeeze blood through your veins and return it to your heart. But the veins in your legs only make up less than half of your circulatory system. And so there are some much bigger ticket items if you do want to drastically improve the circulation in your legs. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain the 4 most important things that you can do to improve circulation in your legs. And those are from the order of most important to least important: diet, aerobic exercise, and those are really kind of together. That one's not more important than the other. Those are by far the 2 most important things. Next after that would be improving fascial mobility in the muscles in your legs. And then finally, way down on the bottom is the muscle pump action to help return blood through your veins and get it to come back to your heart. So let's first talk about diet. And again, diet and aerobic exercise are neck and neck. But diet is really important, particularly limiting your saturated fats and your cholesterols, but largely if you focus on decreasing saturated fat as well as sugar so you don't develop diabetes, which can damage your blood vessels as well. So limiting saturated fat and excessive sugars are really, really important to the health of your blood vessels and thus your circulation. If you get too much saturated fat and cholesterol, you can get deposits that form on the inside of your arteries, and that can make the effective opening of the artery narrower. So it makes it harder for blood to get through the vessel. Likewise, if you have too much sugar, that can damage the arterial walls. And so avoid excessive saturated fats, which is largely fats from animal foods, high-fat meats, full-fat dairy, to some extent eggs, although they're not nearly as bad as people once thought they were. So limiting high levels of animal fats, as well as sugars, particularly processed sugars, are great ways to help improve the circulation in your legs. Next is aerobic exercise, and that works on the muscles in your legs, but even more importantly, the most important muscle in your entire body, and that's your heart. And if your heart's not pumping, not only are you not going to have good circulation, but none of the other muscles are going to matter. And so having a healthy heart is incredibly important to improving your circulation. And when you just do exercises like ankle pumps or leg exercises where you get your muscles working, if you're not getting your heart rate elevated, and ideally doing that for 20 minutes or more, then you're not really improving your circulation to any great extent. Now, most organizations in the United States and in other areas of the world, like the American Heart Association or the American College of Sports Medicine, recommend that you get 150 minutes of moderate intensity exercise through the week. Largely, they recommend 5 days per week of 30 minutes of moderate intensity exercise or more. Now, if you're doing it every day, that 150 minutes averages out to roughly 22 minutes a day. But keep in mind, this is the very bare minimum. Ideally, you want to shoot for at least 30 minutes per day of aerobic activity or moderate intensity activity. Now, if you can't do that for some reason, either due to deconditioning or joint pain like arthritis, or spinal stenosis where it pinches the nerves that go down to your legs, or peripheral vascular disease. If you can't walk for 30 minutes straight, then it is okay to break that up into smaller bouts, doing, say, 2 sets of 15 minutes per day, or 3 bouts of 10 minutes per day, or even 6 bouts of 5 minutes per day. And if you can't even do that, do the best you can. Get as close to that as you can, breaking it up into small chunks so that you get close to 20 to 30 minutes per day of aerobic activity or moderate intensity physical activity. Now, if you have knee pain or hip pain or just hurt your legs too much to walk, it is okay to use an exercise bike. Any form of aerobic activity where you elevate your heart rate will help improve the circulation to your legs. That may be swimming, that may be walking in the water, that may be water aerobics classes. It doesn't really matter as long as you can get your heart rate elevated. That's going to help improve your heart health as well as the circulation in your legs and the rest of your body. So again, number 1 and number 2 are decreasing saturated fats and sugar through diet and increasing your heart health by doing aerobic exercise. If you do those 2 things, then 3 and 4 probably aren't significantly going to matter to any great extent. But just for completeness, number 3 is improving fascial mobility in your legs. Now, what the fascia are is they're like an envelope that wraps all the tissues in your body, including your muscles. And if the fascia surrounding the muscles in your legs, particularly in your calves, gets too stiff or tight, it can start to constrict on the blood vessels. If you have knots in your legs or trigger points in your legs, what happens around a trigger point is that the muscle fibers, if you look at them on a microscopic level, they start to stay in a contracted state. And that contracted state can put extra pressure on the microcirculation, the capillaries and the arterioles. Before we go any further into this discussion, we should probably review blood vessel anatomy if you don't remember that from way back when in health class. So you have, coming from your heart, you have your aorta, which goes into your other main arteries, but your aorta is the biggest artery in your body. Then it branches into smaller and smaller arteries, and those arteries then turn into smaller vessels called arterioles, and then the arterioles turn into capillaries, which are very, very, very tiny vessels at the tissue level where your body exchanges gas and nutrients between your blood and the target tissue, whether it be your muscles or your bones or something else. Then your capillaries then turn into venules, which are very small veins, and then those go into the veins, which then return blood to your heart. So that's the circulatory system. Now, there are some differences between your arteries and your veins. Your arteries, in most of them, have actually a muscular wall where it pushes blood through your vessels down to the target tissues. Then your veins don't have those muscles. And so there is nothing to push the blood back to your heart. And that's where that thing about the muscle pump comes in, which we'll talk about a little bit later. But your veins largely have valves that allow one-way return to the heart. It allows blood to come closer to the heart, but then they come shut and they don't allow the blood to backflow. So if you have normally functioning veins, then you don't need to worry too much about that muscle pump action because the valves in your veins are going to take care of a lot of the venous return. The other difference between your vessels is that you have a descending pressure as you go from artery to arteriole to capillary to venule to vein. And there's a descending pressure as you go through that system, which what that does is it helps push blood from a high pressure area to a low pressure area. In your arteries, the pressure is 120 or so on a normal person when your heart is contracting. That's the top number in your blood pressure called your systolic pressure. And then you have the bottom number, which is your diastolic pressure. That's when the heart is relaxing. And that's roughly around 80 in a normal healthy person. So you have in your arteries a pressure that ranges from 80 to 120 in a normal healthy person, and ideally should average around 100. Then when you get down to the arterial level, that's around 30 to 40. When you start getting down to the capillary level, that's around 20 up to maybe 30 or so. So you have that descending pressure, and then it gets less and less and less as you get into the veins. Now, why is that important? Because if you have muscles and fascia that are too stiff surrounding your blood vessels, and particularly as you start getting into those smaller and smaller vessels, the arterioles and the capillaries, if the muscles surrounding those vessels are too stiff and tight, they can put pressure around the arterioles and the capillaries, and it can actually prevent blood from getting through to the target tissues. In this case, we're talking about your muscles. And so you may feel things like your legs fatiguing quickly as you're walking. And so how do you take care of that? Well, ideally you want to address those trigger points or the knots in your legs, whether it be your thighs or your calves, but the calves are by far the most common place that people will develop those. And by getting those trigger points or knots to relax, you can allow the blood to perfuse the muscles a little bit better. Now, you can do this in various ways, but one way to do it is just to find an area in your calf muscle, and let's say it's the inner calf, because the inner calves are by far the more common place where people get this problem. And just poke around, kind of squeezing the muscle until you find an area that feels stiff or tight. And then you just want to hold a gentle pressure on that area. It's not trying to squeeze it as hard as you can. You're not trying to manually break up a knot. What you're doing is activating a neuromuscular response, which makes that muscle relax over time. And we're talking probably at least 90 seconds or a minute and a half to 3 minutes. So you have to be a little bit patient while doing this, but putting just a gentle pressure on those knots in your muscles for a couple of minutes can help get those muscles to relax. Now, you do need to stretch your calves after doing that, but if you just stretch your calves without releasing trigger points beforehand, then chances are the things that already stretch and move pretty well are going to get stretched out, and the things that don't stretch or move very well because they're knotted or contracted aren't going to stretch out at all. So it is important to kind of get this hyper-focused work if you really want to help improve that local circulation in your calves. Another way that you can do that is using a massage stick or a massage gun. So for example, using a massage stick, you can just roll it along the muscles in your calves like this. And it's not a broad sweeping stroke. You can do that to sort of localize the trigger points, but then once you find one, you kind of want to stay on that area and work back and forth over top of that knot. Kind of stay a little bit localized, and then once you found one and got that worked out, then find another one, and again, kind of be a little bit local and work on that specific trigger point. And what that does is it relaxes the muscles to allow your arteries and particularly your arterioles to perfuse the tissue a little bit better, so you actually get blood flow and circulation to the target tissues that you're trying to get blood flow to. Now, finally, way down on the bottom of the list is activating the muscle pump. And essentially, the muscle pump is using the muscles in your calves or in your legs to help squeeze blood through the veins because you don't have the muscular walls. You need to use the muscles around to help pump blood back through those one-way valves. Now, largely, if you're not immobilized, if you're not in bed, if you haven't recently had a surgery where you can't move your legs for a prolonged period of time, it's very unlikely that you're going to get pooling of blood in your legs if you've got competent valves in your veins, meaning you don't have chronic venous insufficiency where the valves start to fail. But if you've got normally functioning valves and you're not completely immobilized, chances are pretty good that you're going to get decent venous return. But if you are in bed or if you have recently had a surgery, that does increase your risk of getting blood clots. And so it is important to activate that muscle pump to get the blood to return to your heart. You can do that just by doing what they call ankle pumps, where you pump your calf muscles back and forth. You can do that by doing exercises like leg extensions, where you straighten and bend your knee. You can do weight-bearing exercises like squats, but keep in mind all that does is passively squeeze blood up your veins back to your heart. So it works momentarily at the time that you're doing it, but it has no long-term lasting effect. Once you stop doing the movement, that vein pump stops and everything is back to the way it was when you first started. Conversely, when you do specific trigger point work, that does actually change something. It loosens up the muscle so that you have a prolonged increase in perfusion. Now, that doesn't last if you stop exercising or if you don't stretch or if you just go back to doing things the way that you used to, but it is a longer period of improvement. Conversely, things like proper diet and aerobic exercise, they improve things over the really, really, really long term. They actually make your vessels healthier and make your heart healthier so that you get a long-term lasting improvement in your heart health, your vascular health, and thus your circulation. So in summary, the top 4 things for improving the circulation of your legs are diet and aerobic exercise are number 1 and 2 in no particular order. Number 3 is improving the fascial mobility in your legs to increase arterial perfusion. And then number 4, way down at the bottom, is using the muscle pump to help return blood through your veins back to your heart. So hopefully you did find this helpful to improve the circulation in your legs. Now, if you do need more help to improve your circulation and you are in the St. Louis area, you can't exercise because of pain or you need some specific help with those trigger points, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.